This conference will now be recorded.
Oh, good evening.
Good evening.
I don't know who waiting for name is, but if you're new, we'll get back to you. Judy, what's going on with you? How are you? And do you want us to have save time for anything later?
I need time.
Good. How are you doing? We need to know how good you are.
Well, I'm doing okay after 3 treatments of obinutuzumab.
Good. Fantastic. I'd love to hear about that. Jim, how are you?
Oh, I am fine. Nothing going on here.
Lynn?
I do have an update.
Good. We'll get back to you. Hi, Rick. You have an update?
How are you, Sal? It's
Hey,
so
I'm
nice to see you.
actually doing better. They've got me off a couple of the big drugs. They actually
Yeah.
mentioned yesterday that I may have a heart murmur after all this. So we're going through that this week.
Hey.
Join the club.
So the doctor was surprised when she said, "You don't know you have a heart murmur?" I said, "No, if nobody's ever told me that." She goes, "Well, you do now." So that's later. Lou, how are you doing? Good to see you so chipper and bright.
I am. I survived Colorado whitewater rafting, so I'm
Woo!
doing great.
That sounds like fun.
Yeah.
I have an update. I saw my doctor today, so.
Okay, we'll get back to you. Hi, Mary Lou. We can't hear you. You're not.
No.
You're not muted. So something else going on.
Maybe you have the wrong microphone selected or.
The volume.
Your volume.
Yep.
Mary Lou. Nope. Well, welcome anyway. I would suggest logging out and logging back in again. Okay, see you later. And Bill, I don't know if you've introduced yourself to everyone. So,
I have not. Just a little bit of time to do that, so we can let the other people go first.
well, go ahead.
Okay.
Then we'll know who we're talking.
So for those of you that know me, I'm Bill. That don't know me, I'm Bill Franklin. It says ANCAN in front of my name. I do work at ANCAN with that guy in my lower right corner in my window square. My what was that called? Hollywood Squares, right? So yeah. So I'm the COO of ANCAN. I've been with ANCAN for about 10 years, but I just recently took over the role of COO to help Rick and the other behind the scenes personnel run the organization, take on a bigger role. So I'm trying to get to all the groups, introduce myself. Not that you want to see my face, but maybe in the future you'll recognize my face. So. And I do have a connection to blood cancers. My niece, who also works with ANCAN, Kiernan, I don't know if any of you have met her, Kiernan Meehan, she is a survivor of Hodgkin's lymphoma. So.
Okay.
Yeah, we got a new person down there in the corner. 2 people came in.
Yeah,
That's
Leslie.
Mary. Hi, Mary. How's Michigan this afternoon or this evening? You're muted. You don't want to turn off mute today?
We're good. Michigan's good.
Good. I'm glad to hear it. Where's our friendly parrot?
He's in the other room.
Yay! Give him a pat for me. You need any time later?
No, I won't. Thank you.
Okay. Hi, Leslie. How are you today? We can't hear you. And you're not muted, so.
You log, or when you hit the to get on, it has a microphone there too.
And there's Michelle. Good
So
evening,
sorry.
Michelle.
Hi,
Leslie, log off and log on again. See if that helps.
I was having problems getting on. Was not recognizing go to, but anyway, I'm here.
Anyway,
everyone.
do you need time tonight, madam?
Oh, yes,
Good.
I
Well, then
do.
let's start with you.
Me?
Of course.
Oh, well, thank you. I thought perhaps we would start with Bill because he's new.
We've already gone through everybody.
Okay, great.
You're 6 minutes late.
I know. I couldn't get on. Anyway, so I'm in Boston.
Hold on a second, folks. Are we recording or not?
Yes,
Yes.
we are.
Fantastic.
The red dot is on the upper left-hand corner of the screen.
Madam Chair has it all taken care of.
All right.
Okay. Anyway, hello from Boston. I have chronic lymphocytic leukemia. And I have been on Calquence, otherwise called acalabrutinib, a BTK inhibitor, since the end of 2021. This is not my frontline treatment. And the reason I wanted some time to speak is I am curious. If anyone else, I know many of you have had sinus infections, but yeah.
12 weeks.
Geez. Okay, so here are my questions for all of you who have had these ongoing ones or ones that you had in the past. So mine went on forever, but the sinus part is done. My ears remain blocked since the middle of April, and I have had vertigo since the middle of April. Went to and to make life easier to say, an ear doctor. He pointed to a sinus doctor. Went to the sinus doctor. See, they're very specialized. Yes, they're all ENTs, but I went to the sinus doctor, the specialist, who told me it was my ears. So now I have them going like this. And I was told to do physical therapy for my vertigo. Has anyone ever done that? I almost laughed when I heard there was such a thing as physical therapy for your vertigo. Hi, everyone. Now I'm seeing everyone down on the bottom of the screen. So I went, and it hasn't helped. There's some, you can see all this stuff on YouTube, the Eppley maneuver, this maneuver, that maneuver. Now Leslie, I know, can relate to this, and I'm not sure if anyone else can. I hope not, but the ENT specializing in ears was very dismissive the whole time. And I told the sinus specialist about that, and she shrugged her shoulders and now suggested a different one. I made sure that was not on my record, thanks to you, Leslie, after what you've been through. But I finally got an appointment with this other one. Today, they finally call me back, and that appointment is not until October. So I have been a dizzy dame since the middle of April, but only in one, only on one side, I look in a certain way. So now the physical therapist suggested I have my eyes examined. So the eye doctor finally, and by the way, I've told my oncologist this, everyone knows, but no one's talked to each other. So finally, my eye doctor, who isn't even in the system that everybody else is in, the medical system, called my oncologist and said, nobody's talking to each other. And no one seems to have found why this is. And given Michelle's history, I thought, I would call you and maybe you can help get some stuff done, basically. So my nurse practitioner called me and was waiting for a CT scan that the results did come in today. And when they came in, she said that they show nothing other than a deviated septum. She said we could order a brain MRI, but CLL does, and I knew this, infrequently, very rarely, and Judy's nodding, she knows, very rarely goes to the brain. Well, I don't want to be that rare case. She said the other thing is, oh, does happen to someone out there. But the other thing is, I mean, all my blood work is fine. I feel fine other than I'm dizzy. The other side of that is, she said there is, I know, I'm like, I feel good other than I'm dizzy. And she said that sometimes there can be a benign mass or tumor that will cause you to be dizzy, and that'll just be for the rest of your life. So, anyone had dizziness, vertigo for a long time and know what to do about it? Okay. Anyone had vertigo? Uh-huh. And what helped? Leslie? I can't hear you, Leslie. Oh, wait a minute. Hold on. I can't hear. Let me see. Can I unmute you?
We've had a couple of people that we couldn't hear tonight.
Yeah, if I could, Leslie, if you go to the gear icon in the upper right corner and click on that, on settings, there's an audio tab. You may have to select a different microphone device. As it says you're not muted, but we can't hear you.
And you were echoing. Oh,
Can we hear Mary Lou
everybody-
now? Mary Lou went out and came back in.
Mary Lou.
Mary
maybe-
Lou, can we hear you yet?
Oh, we
Nope,
just
she
lost
left
Mary
again.
Lou. Oh,
Having a
Bill,
lot of problems tonight with audio.
I was just having problems, period. Okay, Nancy, well, Leslie, did you understand what Bill was saying? Did it help? You can hear us though.
They're saying she has 4 selections, but none of them worked.
Oh, wow.
Nancy, did you have vertigo?
Yes. Yes. I've had it several times.
And what helped?
Can you hear me?
Yes.
What helped you?
I did a physical therapy balance clinic and worked on, they had me doing a lot of eye exercises where I just would run, move my eyes from side to side, up and down, diagonally, because apparently your eyes, and mine was definitely crystals in my ear, and it's my left ear. And then there is a procedure where they kind of turn your head and turn you over, and we learned how to do that at home, so we can do that. And then if I'm feeling really bad, I'll take meclizine.
So, question, couple of questions. One is, so first of all, they never gave me these eye exercises, although they did them to try to determine which ear canal it was coming from, where the crystals are messed up.
Right.
I was surprised to learn we have crystals in our ears. So just for those of you who have not learned this, we have crystals in our ears, but not the shiny, pretty kind.
Did they have you put the goggles on so that they could really look at your eyes? Because what happens in your eyes tells them a lot about what's going on in your ears.
So, no. Did they do that for you at physical therapy, or the doctor did that?
At physical therapy. The physical therapist did that.
The particular branch of the physical therapy place I went to does not have the goggles, so that's what they are going to try to do next. They thought for sure, because I could even feel my eyes going weird when they had me do those little maneuvers.
You know it.
However, the first time they thought it was one canal, the next time they absolutely thought it was a different canal, which I did too. But have done those maneuvers, but only at physical therapy, because when I do them, it just doesn't seem to be the same. I don't have anyone who's learned it Did your husband help you with it? Because I can't figure out how to get my head
Yes.
down like boom.
No, it's on the internet. It shows you
Right.
the maneuver, and it's not difficult, but if you just follow it step by step, and I think, I don't think you have to have a medical professional to do it. I think you can do it on your own, and your eyes. But one of the biggest things that has helped me is I sleep on a triangle pillow now. That's another thing, because if I sleep flat on my left side, those crystals will come out. They'll fall. And I'll get dizzy and nauseous. But if I sleep at an angle, I don't have it.
We had a triangle pillow and I never knew what it was for. And of course, I got rid of it a few months ago, probably right before this happened, and my ears knew it. Never slept. So those little things you can sleep on, just like this big, or they're bigger ones?
I just put it under my fitted sheet, so it's always on the bed, and then I put my pillow on top of it. But it's it's maybe
7
4 or
inches.
5 inches. Mine's not the tallest one. Mine's they come in different sizes. So,
Judy, did you have that too?
No, but I've used the wedge pillow before.
And so, Nancy, do you remember what ear canal yours is?
I remember what?
Which ear canal?
Left.
That's mine. But
It's
which
my left side. It's my left side mostly.
It's my left side, but there are 3 ear canals. And they said they need to know which one in order to do the correct maneuver.
I never heard that, but
I'd never heard that.
But to be honest, they seem the same. The maneuvers didn't seem a whole lot different to me, one from the other. One called the barbecue roll, not kidding, and the epily. But the epily is the most common.
The epily is what we do.
And did you do it every night?
I whenever I felt it coming on, I just usually would do that because it'll help. And then just trying to sit up for a little while and really staying off my left side flat is the biggest thing, because mine is totally crystal related. It's not. There's also a thing called Meniere's. Has anyone ever heard of that? Meniere's disease?
Yes, I had that.
You had that. That's what caused your vertigo?
It has the same symptoms.
Diese Konferenz wird aufgezeichnet.
Oops. Barbell, there are 2 of you. But anyway.
I know, I changed it. I had really a problem today, with my computer. So I went on the iPad. Now I tried it again, but I went to the browser, and now I'm here.
Now she's only one.
I tell you, in the middle of the night, you have all these technical difficulties.
We all are. Nancy, thank you, and I'll text you for more, so I don't take up everyone
Yes,
else's
but how's Judy doing? Judy's been in infusions, and I just really, I want to know how's it going.
I'll get my turn in a few minutes and tell you.
I know. I want to know too. Sally.
Yes. What?
You had vertigo, but was it?
No,
what was that?
Meniere's syndrome this is many, many years ago.
And how did you get rid of it?
To be honest with you, I don't remember.
That long ago.
I just didn't like it. Well, I hope you're getting better soon.
It's been since the middle of April. Like, I've learned strategies, but still.
I've had my sinus infection since May 20th. And a very deep, phlegmy cough. That's not in my chest, it's in my sinuses.
Wow, I heard your cough a few minutes ago, and
sorry.
I was surprised that you still had the cough part. Oh my gosh.
You have problems with your ears, Sally, also? because
No,
I had some sinusitis and then it went to the ear somehow.
That's what,
no, yours have been clear.
Ears have been clear.
that's good. At least that.
I don't know if something is wrong with my ear. I can still hear, but it feels like a little pressure. And it comes from here, I think, from the
Your station tube.
sinus,
Yeah, your station tube.
because it
Well,
has a connection to the ear.
yeah,
Correct.
absolutely.
Anything
All of
else,
this,
Michelle? Oh,
all of
sorry,
this
Lynn.
discussion about vertigo is making me dizzy.
More dizzy than normal?
Yeah, maybe Nancy could give me a 15-second demonstration of the exercise that will eliminate the vertigo.
Yeah, that I'd like to see too, Lynn.
Anything else, Michelle?
I'm too dizzy watching Nancy go through the exercise here to even think. No, everything else is very good other than that.
Fantastic.
If anyone
Nancy,
else,
I'm sorry we didn't get to you in the beginning. Would you like to tell us who you are and if you'd like some time to speak?
Me?
Nancy.
Nancy. Oh,
Okay, you guys, I'm C. I have CLL, and I am just thrilled to see you all. So, and if there ends up being a little time, I never have. I always have something I can say. So,
Okay, great. Leslie, can you hear us yet?
yeah, I'm logged in on my phone and logged in here. So
How are
my
you
audio,
doing?
I'm using my phone.
Oh,
I'm
great.
sorry.
We
So
can
are you
hear
Hi.
doing
you.
and would you like some time later?
I'll take some time.
Okay, great. And Barbell, how are you doing and would you like some time later?
Yeah, I could speak a little bit. Yeah. It's been
Okay.
a while.
Well, then we'll go back and start with Judy. How are you? Let us know what's going on.
Well, I started adding treatment. I've been on the pirtobrutinib for 17 months, and Dr. Wan said my CLL was kicking up more, and I'm having a little bit of, not anything great, but because of my history with the Richters and all, he doesn't let it get bad before he starts in with something else. So I added on uh, the last week of July, 2 weeks ago, I started taking obinutuzumab, and I take it the first and second day, and then the eighth day was this past Monday, and I'll take another one this coming Monday, and then skip 2 weeks and take the next one, and then I'll do six months of that. And I haven't had any kind of reaction except for the first week. Uh, a day into it, I had spiked like 100.7 fever at night, but it resolved on its own by the next morning, in late morning. But I'd already contacted the clinic and they wanted me to just come on in and be checked out. And of course, everything checked out fine. I did have blood tests on Tuesday of this week after the third infusion, and my white blood count doubled from the time before, as well as neutrophils, and they said that that was not unusual because of probably the steroid from the pre-meds. I haven't really had any reaction. I think that I probably have not had much reaction, mainly because I've been on the pirtobrutinib for so long. I think my tumor lysis was very slight, if anything. So I did start taking the alpurinol, and in a couple of months, they will add venetoclax to the deal. Most people, like Nancy and some of the others, have gotten the acalabrutinib, but because I was already on the pirtobrutinib, they kept me on that. And there is studies going on with that triplet on naive CLL.
Right? That's what I
Uh,
had.
So this would be, when are they adding the ven on?
The second month of obinutuzumab.
So in
So
another week or two?
no, I won't finish 1 month until the end of August will be the end of August will be my first one of the second go around.
Yep.
So it'll be 1 more month, I think.
And then
So
they'll ramp you up on that
So,
too?
so the end of September, I think, the last week of September probably, because I start at the end of July.
So you're saying frontline, yeah, there's a trial for Perto, Obin, and
Right,
Ben, just like they had AVO.
right.
Did you do that one before, AVO?
No, I haven't ever been on a trial, and Dr. Wan has real problems getting me on a trial because of having Richter's. And so I don't qualify for a lot of trials. So, he goes around off, some of the things off label, which would be what I'm doing is actually on a trial, but not with, this is my 5th treatment.
So Judy, which drug did you say you're going to add at the latter part of September?
Venetoclax.
Okay. Okay.
Yeah. And hopefully this will be, a year or two, like Nancy and them have on a fixed duration, we hope. We'll see how it goes. So I'm hoping, every treatment I've had about 2.5 to 3.5 years in between, because this is my 10th year of dealing with all of this. So
Will you stay on the, sorry, everybody keeps moving on the screen, so I was trying to find you. Will you be staying on the Perto the whole time?
Yes.
And indefinitely, or do you get to come off of it at the end of the venetoclax?
Well, I think it'll all depend. One of the reasons that he wanted to go on, since I was having some progression, is that the pirtobrutinib's in the trials is 18 months of being effective. And so I was at 17 months and having some progression. So I think that's why he wanted to go on and us, start something else, because he knew that the Perto does not have a longevity of being effective.
Which is, yeah, I found that interesting when that finding came out.
Didn't know that.
Yeah.
I didn't know that either.
Only 17 months.
In the trials, the median was 18 months for it to be effective. Or some people, had longer and some had shorter, but the median time was 18 months.
Which trial was that?
It was when pirtobrutinib was being approved.
The Bruin trial.
Yeah.
The Bruin trial.
I believe that was
they
the
said
Bruin
after
trial.
18 months it stopped working.
No, didn't the median.
The median.
Yeah, the medium. But, this is anyway, something to go by.
Yeah.
Well, he's great to stay on top of everything for you. How are you feeling now?
He is,
I'm sorry.
Yeah, he's very good at staying on top of it, especially with my history. So very great. And I haven't really had any side effects. I've been very fatigued. I have been that, especially this week when I was not going to have to drive three times to Dallas because my friend lives close, like 10 minutes, but she came down with COVID. So I had to drive the 3 days to Dallas, which is about an hour's trip. And that I was pretty fatigued from, doing all of that coming in. But that's the biggest side effect I've had is fatigue.
Good. I didn't know COVID was back active again.
I didn't
I
either.
don't think it's ever gone away completely. It usually in the summer is not very much. But she went to New York City week before last, and whether she got it on the plane or in New York, who knows? So
In New York.
probably. But she had hugged me the day before and was very concerned that I might get it. But I've had 3 Pemgarda treatments since December. And I think probably, that's supposed to be protecting us from COVID. So
Do
I
you
wasn't.
get IVIG?
Yes, I also had week before last, the 3rd week in July, I had 10 appointments. I got IVIG, I got Pemgarda too, and so I had both of those recently. And then yesterday, I also had pentamidine breathing treatment, which I'll have monthly, also besides my treatment.
Now,
But they've also found that IVIG helps with COVID as well because you're getting everybody else's antibodies as well.
Right, absolutely.
Yeah.
But I will
So
have 3.
Leslie, can you tell us what's going on with you?
Me?
You.
Okay.
you.
You said you'd like some
I
time.
have a little bit of a weird echo with my phone, so I have my volume and everything off from the computer, but for some reason my phone's being weird. But anyway, so I've been fighting infection since January. Lower and upper, don't know what it is. I've been telling him, you need to check my IVG and oh, it's normal. But then you look at the other ones, it's not just the IgG, there's other ones too, right? So the A and the M.
IgM, yeah.
And those are both running low. And they said, well, the IgG is the only one that we have to worry about. Well, that's not true.
That's not true.
So being the bitch that I am, I push. And I told him, I said, look, I didn't see Dr. Jane. I saw a nurse practitioner again, which is normal for down there for some reason. But anyways, she checked them all and she said, they're low. They're all low, except for just the IgG. But the other 4 levels of IgG are all low. So now I'm waiting to hear back. I was supposed to hear back this week. Oh, it won't be until next Tuesday now. They changed the appointment for some reason. Or we're waiting for more tests to come in. I have some kind of a bacterial infection that's not leaving my body. And so I think they're trying to figure out what that is. They did all the tests. They did the flu, the COVID, the A and B flu, the strep throat, everything. They're just trying to figure out. I've had that stuff it's not in my lungs. My lungs have been clear every time. It's right
Leslie,
here.
I have the same thing.
It started with a sore throat, and it's like somebody took a lighter to my throat, or I've been out in the smoke. It's just like a burning pain, but it's not a sore throat, if that makes sense. It's like I inhaled too much smoke somewhere or something, but I haven't been out to do that. And it
reported on the news like that.
Sorry?
What?
There was something reported on the news about people's throat not long ago. I can't remember what they said it was though.
Yeah, but they're testing everything. They're doing deep dive this time. So, and I sound like Sally. There's nothing except for that cough, and sometimes it'll hurt really bad. It's worse at night.
I have to take codeine at night just to sleep.
They gave me a cough medicine that has hydrocodone in it because I'm allergic to codeine.
Okay.
So I take that for the cough as well. But I told him, I said, let's do an IVIG treatment, because between 5 urinary tract infections since January, this stuff, another infection, my body's not clearing anything by itself. And they're like, oh, well, but now I kept telling them, we need to do something. It's ridiculous. I can't keep
Leslie,
doing
what's
that.
your IgG number? Do you know?
I don't know it offhand.
If it's not below 500, an additional IVIG treatment probably won't do that much. But I get one monthly because mine drops to be about 400 every month.
Yeah, I don't know what it is offhand, but I know that I'm a person that goes into ChatGPT and looks stuff up, and I put in everything in there, and it's telling me they need to look into giving you some IVIG. And so
It won't hurt
that's
you.
where I'm getting, yeah, it won't hurt me. It might hurt the insurance.
They won't pay
And
for
that's
it.
the big,
My insurance, Medicare, will not pay for it if my IgG is not below 500.
yeah,
Mine's
yeah. So
below 600.
It depends on your
my
insurance. I've learned.
yeah,
It depends which
my
plan.
IgM is 22. And the lowest it should be is 50, and that's low. And I'm at 22. My IgA is at 104, and my IgG is at 622. So it's on the low side. But
It's
then
on the
when
low
they get
side,
into the, yeah, and then when,
One for 659. So.
Say what, Judy?
yeah,
I said I had mine last one. I was at 659, but it was because I was fixing to go into treatment that Dr. Awan went on and overrode it or whatever.
yeah, I've been off my acalabrutinib for a month. They don't want me taking it with the infections. So
have they tried Bactrim on you yet?
yeah, I
I've had
can't
5
take anything.
antibiotics. I've had 5 different ones.
Yep. Ceftonare, Cefta something else, Cefta, all kinds of
No, I've had
Bactrim type
amoxicillin,
stuff.
Augmentin, Z-Pak.
I'm allergic to amoxicillin, so I can't take that one. That's the one they all want to give me, and I'm allergic to it. And then they won't give you any kind of penicillin because you're allergic to amoxicillin.
I'll try Augmentin. That's the one that sort of helped me the most.
Yep.
Even
Prednisone, they did double treatment last time plus prednisone. 2 different antibiotics, a Z-Pak and prednisone, and it's still there.
What's the longest? What's the longest you were on?
What, Michelle?
I'm just gonna say, what's the longest duration they had you on Augmentin at a time?
14 days.
They had me
just the one time, and that was just the one time.
Well, they had me on a
just a regular dose of it.
Oh, they gave it to me.
I don't remember. I've been on so many of them.
I
don't know.
It took me to be on it 28 days.
Wow.
To get rid of my sinus infection. They gave it to me for whatever it is, 7 or 10 days. At first, that did nothing, and then it continued on. But that was in January, so I had it. I really started in January, and they did that. But the ears started in April because nothing happened because they only gave me a normal course. Sally, they gave it to you, right, for a long time, or one of them?
I've had most of them for 10 days. Augmentin was for 14, and Augmentin, and they're talking about putting me back on amoxicillin because they feel that did the best. Because it actually cleared it up, and I was off of it after I went through the series. I was off of it for 4 days, and it all came back.
Well, I have to say that I had it. I still felt like I had it until I started like day 27. So there really is something to being on them for a prolonged period of time. So Sally,
thank you. I'll try that tomorrow. I have another appointment tomorrow.
So yeah, maybe since amoxicillin seemed to work, go on it for a longer time. I don't know. Leslie, I don't know if that one of these would help you too, going, doing that. I don't think that that's that abnormal when you have one of these going on a long time and like you're immunocompromised. Interesting, they had you stop. You've been really, really sick, much sicker than I was. So, but I understand them stopping your acalabrutinib because it's kind of making you more immunocompromised.
Dr. Awan
kind of scary though.
Had me stop.
To not be on it.
He always had me stop anytime I'm taking an antibiotic.
Yeah, and I have to call them and search and pray that somebody will get back to me to find out if I'm supposed to stop or not. It's been ridiculous.
That's why I changed doctors last week.
You did?
I tried and they wouldn't let me.
No, my
Sally has
primary
been a
care.
mess.
But the other news
Yeah.
is Abenor is going to Miami.
Miami's really like attracting people.
Well, Longren is in Miami, and Abenor is the big gun in the Midwest, and he's been here for 35 years or 40. He must have been given half the world to go to Miami, but he told me what the two of them are doing is putting together an institute to train myeloma specialists. They only will train specialists in myeloma. I think that's cool.
Where will they be
That's
affiliated?
cool.
In Miami.
But I mean, University of Miami Medical Center.
I think Longren's at the University of Miami.
They've really been beefing up their hemonc department.
Yep.
That's great to hear. Maybe I would have stayed there if all this had happened way back when. All these things.
Where are you, Leslie? You moved. Oh, there you are down there.
And it's just like a game show right now. Everybody's like moving. Leslie.
So we're moving next year. We're going to Idaho. And so I'll be going to Huntsman Cancer Center in Salt Lake City, Utah.
Salt Lake City. Yeah, they're very good.
I've already got a doctor. I did all my research. I'm not going to get just stuck with the
headquarters
doctor. I'm going to tell them
Street,
who I want to see. I'm going to tell them exactly who I want to see. They're not going to just throw me in with somebody. And I am going to tell them that, we're going to get my records. They've already looked at my records. I've already talked to them. They looked at my records. And I'm just going to tell them that you need to know that I'm not going to just stand by and take whatever you throw at me. We're going to have discussions like they did down here. It was, this is your treatment and this is what we're going to do. There wasn't any option. I said, what about clinicals? No, there's no clinical for you. I'm like, okay. I was scared. I knew nothing. So I just did what he said. What do they call it when they just give you a treatment that they give everybody else?
Standard of care?
Yes, standard of care. He said, you get standard of care.
Why? It's your frontline treatment. It's your frontline treatment. And you don't have comorbidities, so that's crazy.
Well, I do, though.
Oh, okay.
I do have. I've got heart condition. I'm obese. At that time, we thought I had asthma. So I do have some issues. And that's why it was just, oh, no, standard treatment. You're old and we don't want to put you through anything. You might die.
You're on a
Try being 80.
Yeah.
Leslie, you're on a calibrutinib and you have heart issues?
Yeah. You know how scary that was when they first gave me the paperwork, the first oncologist, before I got the third opinion, and said, here, we're going to give you this. Here's the paperwork. Go home. I'm done with you. And I read that. I wouldn't get it. I wouldn't take it. That's why I got a second and then a third opinion. And then come to find out I have congestive heart failure. And I've been telling people, please check, because my mom, that's what she had. And they kept, oh, you're fine, you're fine, you're fine. Well, guess what? I have congestive heart failure. So I'm thinking maybe the medication got that pumped up and going. I don't know, because nobody found it before the acalabrutinib. So it's a circus. And I'm just one of their clowns, I guess. But it'll be okay.
You're a smart clown.
We've heard now that Hulk Hogan died of a heart attack and also had CLL, and I'm wondering what treatment he was on. Wondering if he might have been on a BTK inhibitor.
Yeah. Who knows?
Barbell, you said you wanted some time.
Oh, I'm sorry. One last question for Leslie. So do you have your appointment already scheduled for when you move?
Not yet. Because we're not for sure what day we're going to be there. We just know that he'll retire. He'll retire in July, and then we're getting the hell out of Texas. Sorry. We just can't do the heat.
When my Blue Cross Blue Shield initially paid for my IVIG. They changed their numbers of acceptance for IgG levels. TRICARE, which you have, if I remember correctly, TRICARE pays for it. But that's how I know they all have different numbers that are okay with them on your levels.
Right. And so Medicare, from what I read recently, Medicare is paying for them now, and they're doing some changes. So I don't know if this is prior to, Sally, or after what you found out.
I know.
So, well, it's worth a try, because if I don't know how that works with if TRICARE will pick it up if your Medicare denies it, but I know Blue Cross denied it, and then TRICARE did pay for it, did accept it. So it's worth a try to fight for it once you have your appointments.
Right.
I'll tell you.
Right.
Well, anyway,
my feelings for this is if somebody could explain to the insurance companies that denying this causes us to be sicker and have to pay out more from our insurance, you might want to rethink this a little bit.
I think you need to be an advocate, Leslie. I'm serious. That's exactly advocating right there. That's fabulous. But you're right. I wish they would.
They don't think. They don't. But
it's the bottom line.
Yeah. Which is stupid, because it just causes more bottom line for them in reality, you know.
Exactly. I hope for you and Sally, I mean, that you both have had, this is why these groups are good though too. Not that it's good you both have this, but you both have, it sounds like the same thing.
So do you.
Yeah.
Well, yeah, luckily mine right now, I mean, I'm lucky and I don't have the rest. I just have the lack of hearing and vertigo.
Yeah.
My crystals are messed up.
It's all in our heads. Well, they treated me for bronchitis for 3 weeks before they figured out it wasn't in my lungs.
But you sound.
Now you sound like the male doctor, Sally, when you say it's all in our heads.
But they're smart heads.
Yeah, if you're female, it's always all in your head, or your hormones.
Okay. Well, I had my blood work done. My blood work is fine, but I don't know yet how high the IgM is, but it's low. I can see it on my rash that the pimples get smaller. So I'll see how it goes. You know, kind of worried about my ear a little bit, because it's very annoying when you have a problem with the ear, isn't it, Michelle?
It is annoying. Is a good word for it. Annoying.
It feels like there's some pressure on it, and I can hear. You know, it's the hearing is not impaired, not really, and it's also not inflamed, but it feels funny. And I did all kinds of tricks, yawning and biting, and all the tricks that they give you, but it doesn't work. And I have no idea what it is.
One of the things that sometimes you can do is use a saline a lot for your nose, because that's kind of all connected to your station tube.
I know. They told me to pressure here, and I did that, but it doesn't work.
Also, massaging your neck and a really warm rag or warmth on your neck.
On your neck, really?
I do the light again.
Your station tube's coming kind of
like touching hammer or something. You know, it feels really
30 years ago, I had a stopped up ear, and after several rounds of different medicines, my doctor put a tube in that ear and cleared it up immediately. And the tube fell out about 6 months later, but I haven't had any trouble with that since that.
You know, Elise and I had.
I'm sorry.
Probably have to go to an ear doctor. I was already thinking.
And putting the tube in the ear was very simple. They put some drops in my ear. I laid there on the table. And about 10 minutes later, they came back in and said, you'll feel a little bit of pressure. And that was it. They inserted it, and he came in with a little vacuum cleaner, and everything was clear.
Ah,
Right there and
okay.
then? It became clear
Yeah,
then? Wow.
yeah, yes.
Wow.
Of course, that was just my experience, and that doesn't mean it's a solution for everybody else or anybody else, but it worked for me.
Yeah, the sinus specialist said that her guess, but her specialty is in ears. All these specialists now, as opposed to just an ENT, but she said she suspected it might be my eustachian tube. But how do they test for that? Do you remember?
I've had two sinus X-rays.
I just had my CT scan. Oh, you had an X-ray?
They did mine by X-ray.
Huh. Nancy, what did they do to you? Do you remember? I didn't have that, by the way, until last week, all this time, and finally had one. Where's Leslie?
Leslie, she went away, and all we see is this weird picture.
Or Belle, did you say you had a CT scan or you didn't?
Well, yes, I had a CT scan, but here they said there's only the bone. There's a lot of the mucus is missing really on this side because of the sinusitis I had before my first treatment. So maybe there's not enough protection anymore, and maybe the bacteria go to the ear or something. There is a connection, and I don't know. I'll have to do something. I looked on the internet and it said to put some olive oil in there, 2 drops, like this, and then lay on it for 10 minutes.
Make sure the olive oil is warm. I mean, not hot, but warm.
Warm,
Does
yeah,
work.
but they said you should use it in room temperature, because if it's too hot, it can damage the ear,
Right,
and
that's what I was saying.
that is a problem, with heating it up.
And you did that?
Oh. Well, Lou, you wanted some time. You're muted, yeah.
So no.
Okay.
Oh, I got stuck on my the little mouse went off, so my picture went up too.
I don't know if anybody else has had trouble, but all evening so far, I've been going in and out of the meeting, and it says audio not connected. And anyway,
Video doesn't work for me. Didn't work for me at first.
anyway, so I hope I don't fade, but we'll do the best.
You're looking too good to fade.
I did see my doctor today, Dr. Abdallah at University of Kansas Hospital. He's incredible. I have had 3 weeks ago a kidney infection. So he thinks it's kind of affected my kappa a little bit. So it went up a little bit, like point, 1, 2 or whatever. But then it went back down. So he thinks it's just the medication, as well as, the fact that I had the kidney infection that affected the kappa. But
Or a lab test problem.
everything else is good. They do not find any myeloma in bone marrow or blood work. The electrophoresis does not show anything.
Oh, I'm so happy for you.
Yeah, the kappa he's not concerned about because he said it's on its way back down. So, but because of that, I'm not considered, in complete remission. Right now, it's partial. So I'll take it. And it is going in the right direction. And a lot of people have them off of 110 days out now.
You froze for a second.
Yeah, you're frozen now.
Yeah, she's going in and out.
I think she said
Lou's birthday was last week too.
Say that again.
Another
Lou's
year.
birthday was last week, and her first book has been published.
Wow. That's a
I
huge
like
week.
how you said that first.
Can,
Yeah.
can hear her now.
Can you hear me?
You're breaking
Can you
up, but
hear?
that's okay.
Yeah, you're breaking up.
Okay. Okay. Like I said, I've been having trouble off and on all evening. Dr. Abdallah said the nicest thing. He said that he bought my book, and the nurse practitioner also said they bought my book, and he said he thinks it would be helpful for any of the patients and all. He really thought it was a great resource. So he is going to bat for David and I to be able to share a little bit, I guess, at a meeting that's coming up at the University of Kansas uh, to promote patient, having resources available. And that's exciting because this is, having your doctor and the staff say, they're excited and want to have, the book promoted. That's a lot, and we were excited about that. Uh, the Today I was supposed to have.
See, that's
Today,
that's the press looking to cover your book. The
yeah,
New York Times wants to do a book review on you.
yeah. But anyway, the IVIG, I was supposed to get that today, but my IgG numbers were 636, I believe. So he canceled that. He thought, my body is starting to heal itself, in that regard. So I'm not having to have the IVIG very frequently. I had it once about a month and a half ago. So that's good. Um, my body is doing what it's supposed to do. Uh, I think, overall, I, I'm doing really well, and energy wise, uh, it's good. It's, improving all the time. You got my book, Sally.
I think I was one of the first.
I think so. I think so. We're learning all kinds of stuff in the book making world that we did not know. Um, so, it's been, exciting and kind of eye-opening to learn things that we did not know about. You know, we did not know that the algorithm for a book to come up supporting a blood cancer, like our book is for, um, we didn't know that the more reviews you get, the higher up on the algorithm scale your book will go. So,
I've already reviewed it.
So we need to give you glowing reviews.
oh, that would be wonderful. You can, I mean, the the softback book is, obviously expensive, more expensive than the ebook, but you can get the ebook for like $3.99 or something. So, and just to let you know, this is not to promote for David and I. All of the profits from our book sales will go to myeloma research. So it will be the IMF, it will be NCAN, it will be MMR Foundation. So any of the research groups that has helped us through this journey will be rotating the donations. So, but the first one has to go to KU, to support obviously the doctor who has helped me survive for 12 plus years. So that's pretty much all as far as an update. Oh, we went last week. We just got back from Colorado. If you are a Facebook friend of mine, you can see pictures of our river rafting. I figured to celebrate having gone through my 5th clinical trial and my birthday, I wanted to whitewater raft. David and I have done it for the last 30 years, several different times. But, we're getting up in age, and I'm only, at that time, I was 108 days out from my CAR T. So, I know that a lot of people don't, recover as quickly. But I did. I felt good. And I did not ask my doctor's permission. I told him today, and I showed a picture of David and I going, ah, with paddles in our hands and all suited up.
Froze again.
Colorado. Exciting. So that's all I had.
What did he say?
He said, oh my goodness. Doctors always want you to be very careful sometimes, right after you have a procedure like a CAR T or, transplant, stuff like that. So I felt good. My numbers were good. And the only person who was worried about me, obviously my husband. David does enough worry for both of us. And our granddaughter, our 18-year-old granddaughter, who just graduated from high school in May. It was a kind of a gift to her also for her graduation gift. So she was with us, but I told the guide on the rafting trip, I said, hey, we feel very safe. We're older, but we feel very safe because our granddaughter is a lifeguard and teaches teaches swimming lessons. Sorry. Yeah, I know. I love music. But she is very, very capable of rescuing us. So he said, great. I love having people like that in my raft. So
That's wonderful, Lou. Such great news.
we had a
Lynn, do you have anything to enlighten us with?
Well, as a matter of fact, I finally got to see my pulmonologist after a delay of about 3 to 4 months. Just to give a little background, diagnosed with small lymphocytic lymphoma in 2013, began treatment in 2014. My second line of treatment was ibrutinib, and I was on that for 9 years. But while I was on it, there began to be evidence of progressive idiopathic pulmonary fibrosis, which means your lungs are turning into concrete and they don't know what the cause is, but it is progressing. And so finally, I was able to connect with Dr. Awan at UT Southwest in Dallas. I connected with him 2023 rather. And he promptly said, let's stop the ibrutinib. That's contributing to this problem. And so I've been off of it for 27 months. And I went this week, I went and had a CAT scan at UT Southwest and saw the pulmonologist, and she said, it's stable. There's no sign of any progression anymore. You're doing well. And also, I said, well, look at check my lymph nodes in the CT scan. And so she backed up and went through this, checking those. Since I've got lymphoma, she said, all your lymph nodes look normal. And so that was all good news. My oncologist had tacked on to this chest CT scan to also do a neck and abdomen. But when they delayed the chest CT scan, I said, cancel the other two. I don't want to do the other two until we see what the chest CT scan looks like. And if it warrants any further CT scans, we'll do them. Otherwise, since it cost me $300 out of pocket, I don't want to do them. So $300 a piece. So anyway, so that's where we are. I do see my oncologist in October, and and my last blood work was done for my primary care physician at the end of June, and everything looked good there. So
Hooray!
we're just kind of having a party over here, just celebrating. Stopped at Papa Do's
When's
and
the
had
barbecue?
well, the barbecue Tomorrow we'll meet you at well, could meet you at the shed, or we could meet you at Jay's Barbecue, or we could go have steak at Perenni Ranch House. These are all places that Nancy knows about. And there's Joe Allen's Barbecue, and there's Sharon. She and Joe got divorced, and so she's got her own separate barbecue place.
Well, hopefully someday we'll all do that.
Look forward
Anybody,
to it.
do you
Mary,
live close to Irving? Any of you Texas people?
I'm very close.
I'll have to write to you, Judy. I'm coming to Irving in the middle of September.
Oh, good. Let's connect.
You too, Leslie? Oh, must. Okay. Who else? Nancy? Well, Nancy, you're close to me right now. Kind of.
Yeah.
I
She'll-
am, but I'll be back in Texas in September. So I'll come to Irving if you're there.
Good, whether we see each other here or not. And Judy?
Well, at Frisco it's just down the road. I mean, we're
Close.
probably 10, 15 miles, maybe.
Wow.
Yeah.
Let us know when it happens. We might drive over.
Oh my gosh.
It's
Look at
not-
all these people in Texas.
Yeah.
Barbell, it's a little
our
far.
CLL,
What?
yeah, our CLL Society group is going to have a face-to-face meeting probably in the latter part of September, I think. We won't know.
Right now, it's kind of scheduled for October 5th.
Okay.
Is because of you being gone and Elise being
Nancy.
gone and when it fit Dr. Awan too. So, yeah.
So we're gonna have a party. Sounds like I'm gonna have to come in definitely a day early or something.
Sure. Come on.
Mary, did you have something to share with us?
I'm doing well, so I don't have anything to report.
That's wonderful news.
Yep.
Been with you from the day one. Jim, do you have anything you would like to share with us?
No, except my sister seems to be pretty good now.
Good.
Okay, especially after the cancer in the brain. Okay, and the surgery and the radiation and all kinds of stuff. They say everything's good now. So
Good.
it's amazing.
Fantastic.
That seems like a miracle.
It really does.
She's tough.
That must run in your family. That's
Well,
great to hear.
Other than what I'm going through, along with Michelle and Leslie, I'm still in remission from my one treatment of Elrexio, and Dr. Abinor says I probably won't see any changes in that until after September. And he too has held up my treatment because of this infection.
So you're off then.
I've had one infusion, or not infusion, one injection, but I went into total remission after that one. So my light chains are actually -1.
Still.
And I asked, are they coming back? And he says yes, but they'll be slow. So.
And how many were you supposed to have?
One a week.
And you had just one.
Yeah. I was supposed to start off with one a week. Then I was supposed to start one every other week because I had such a good reaction. And now it was one a month, and I've only had the first one. But because it worked so well. I went into remission in 6 days after the step-up doses.
Wow.
That's amazing.
It's amazing to me too. So I think it was amazing to him as well. I remember my first appointment after my step-up, which was in May. And as I was leaving, he turns around and goes, "How did you get here?" And I said, "I drove." He goes, "Didn't anybody tell you you're not supposed to drive for 8 weeks?" And I said, "No." I said, "Nobody gave me any instructions when I was leaving the hospital." And he says, "How are you getting home?" I said, "I'm driving." He goes, "Okay." Because I had no CRS, I had no ICANS, I had no reaction except I had a slight fever one night at the hospital, and they kept me over for another day, but that was it.
You and Lou, you and Lou are like super achievers.
Does anyone else have anything to add or say, or?
Nancy, I think, said she had something.
I think she does. She was talking. Nancy, do you have more to share with us?
No, I don't have a lot. I just I'm my CLL. I did my second clonoSEQ this like in May and got back, and it's still undetected. So that's great going into the second year off treatment. And my beta blocker is all just trucking along. I just take it every morning, and it's doing its thing, and that's all
Do you have
good.
any side effects from that?
I'm not. I mean, Ty. I'm lower. I had started to get back energy from the venetoclax and the CLL, and I thought, this is crazy. I feel better than I've ever felt since being diagnosed. And then I had the tachycardia and got the beta blocker, and it was sort of a setback, fatigue wise. But I know how to live that way, so it's fine. And then the thing that's different, and I think part of it has to do maybe with being in Vermont, is I have bursitis in one hip. And in Vermont, I thought I was going to really do a lot more hiking and walking, and I can't. It's inflammation, and it's just, so I'm taking turmeric. Tylenol knocks it out, but you can't, I mean, not Tylenol, Aleve. It's an NSAID, but I can't, I don't want to, I'm not supposed to. My orthopedic doctor says it's fine for me to take that, but at the same time, the bottle says don't take it more than 10 days. So I'm trying to not do it. And then my physician husband says, "Oh, you should take it twice a day for 2 weeks straight. Do it like and I'm like, okay, I'm going to take it as needed." So, I'm kind of on my own path on that. And that is the biggest thing right now is just the pain in my hip. And sometimes when it's bad, I limp. But the reason I say about Vermont, it's so much more humid here. And of course,
Hi, Indiana.
one of the internet things mentioned that. And so since the internet is going to be our guide, I just thought about that. And so who knows, maybe when I go back to Texas, it won't be as bad. And
Nancy did not tell you. Texas. Yeah, Nancy did not tell you what you need is some bee stings.
Yes. Lynn suggested bee sting therapy, which apparently is a thing. And I'm going to let him take the first dose of that. So we'll ask him next month how he felt about it and what happened, and if it improved his attitude.
It took my mind off of my bursitis.
This is bursitis that you use bee sting therapy for?
Bee bursitis.
Right, but you get a bee sting for your bee bursitis, for your bursitis.
You can also find bee serum or bee sting cream, and I hate to tell you, it really works. It works on my neuropathy.
See,
neuropathy.
See, I'm not gaslighting you. I'm not blowing smoke.
No, you're not. It's true.
Voltaren works well too.
What was that one?
Voltaren. Voltaren.
Voltaren, yeah.
Yeah, I've rubbed that on my husband's back for ages, and I still have lots of prescription that he had left. And when I get a catch in my hip or something, like it's a sciatic, I'll use it, and it relieves it.
So
The
check out my.
Bee sting lotion does a prescription, so you don't have to worry about it.
Well, Voltaren
I
can
haven't.
get over the counter now too.
Oh, okay.
Excuse me, Judy. Excuse me, Judy. There is a generic for it, which is twice the size and one half the cost.
Okay, I didn't know whether that had come out.
Oh, absolutely. It's
I get a
In the chat, Jim, please.
yes. I will put it into the chat.
It's Diffa something. I forgot how you pronounce
Yeah.
it. They had generic of that by prescription. I know that we got it like that with prescription.
So I actually have a story that was just published today on Help for Neuropathy. It's on Patient Power.
Oh, okay.
And there is Mass General Hospital, or now known as Mass General Brigham. They're trying to have they have an integrated oncology department. It's something they're building up, and they have a rheumatologist that also treats cancer patients who have been on, and basically it comes down to any treatment, it seems, can cause neuropathy. At first they thought it was just chemo, then they thought it was chemo and radiation, then they realized immunotherapies, and now targeted treatment. All of these things can cause neuropathy. So they have the rheumatologist, because the rheumatologist she studied a special technique. I mean, a lot of doctors, I guess, do ultrasound guided steroid injections into joints and nerve areas that have been affected by neuropathy. However, she has a special technique that she had studied she's one of the few that does it, and she's been training other doctors to do this. And I have to say, for my hand, this time around, I only have it in my hands. Frontline, I had hands and feet. But anyway, it has worked wonders. It only lasts like 4 to 6 months, and then I have it done again. I think I had to end up waiting maybe 7 months to get another appointment, but it's just amazing. And I mean, you can see it on the screen, how it inflames things. So I think I'll also try the bee sting thing, though. Now
Would you put that in the chat as well? The name of it?
I hope I don't lose you all by looking for it. Yes.
So
Going to get the link.
The bee deal is a lotion, Sally?
Yeah. You can just go on Amazon and look for, bee sting serum, or, that's where I found it.
Or bee venom.
Bee venom, yeah, thank you.
So how does it help you with your neuropathy? What do you feel different?
It doesn't hurt.
Oh, it doesn't hurt. It just is there.
Well, mine actually, the skin almost hurts. I mean, it just hurts. It just feels better when I put it on.
Okay.
So just so you know, this article, I am putting the link in, but I wrote it originally for all cancers. But they decided, for whatever reason, they wanted it just for CLL. But this does apply to everyone here. The bee sting thing, though, I have to find both for my husband as well and myself. Okay, here we go.
It's on the same page that you just sent us. It's the second line. What you just sent it.
Mine just shows up like for face firming.
No, well, mine says bee sting, bee venom.
Now that's pretty handy.
I just put a link on there for Amazon.
We can get a twofer.
Venom salve.
Allie, is yours the cream?
Yeah.
Wait a minute. So yours is the second one, Sally, and Leslie?
Leslie is the one that sent Leslie sent it, is the bee venom link.
It's bee venom treatment cream,
Yep.
$13.99, or two small ones for $12.99.
There's lots of choices.
So is there a certain brand that you use?
I don't remember which one I have. It's back in my bedroom. But they work. So
It also has one that says that it also is firming and wrinkle removing.
I'm
hey,
in.
everything works.
I better
for
get a
everything
big jar.
anymore.
I need a big jar for that, Judy.
I need a bathtub.
I was just
Yeah,
thinking a bath in
yeah.
it would be pretty good.
Then there's a
Yeah,
Botoxin.
All right, I got mine ordered. I'm excited. Look at
let
you,
us know,
Lynn. Is Lynn
Nancy.
still on? Nope, I think Lynn's gone off. Too bad. Oh, there you are, Lynn. Thank you.
Lynn's
See,
here.
look, you got it all going on it.
Did you
Sally,
pull the first one?
finish line.
That's how Lynn got rid of all his wrinkles. That's why he has such subtle skin.
Yes.
Nice
Soft as
hat.
baby.
Very nice hat.
Thank you. It's summary
Well,
here.
it's past my
Summary.
bedtime. Does anybody else have anything they'd like to share?
Well, I've had the hand up for about 5 minutes. I was waiting for all you gals to get done. Peripheral neuropathy. I got it from the triple bypass, and therefore I take vitamin B6, 100 in the morning and 200 at night. And it seems to calm it down. And it took about 3 weeks for it to kick in, but it's been fine since.
Great.
So
Can you repeat that dosage, Jim?
100 in the morning and 200 before bed.
It's interesting. Dr. Juan told me to take B12 and folic acid.
Well, I also take B12 250 in the morning, so I don't know if that helps it, but the folic acid, no.
Yeah, I also take 600 milligrams of alpha lipoic acid twice a day, and that has always helped.
What is it? It helps. It probably helps with other things, right? Too.
I beg your pardon?
Probably helps with other things as well. Alpha lipoic.
It's a nerve.
Joint? Oh.
No, not joints. It's all nerve.
What was it you took, Sally?
Alpha lipoic acid.
Lipoic acid.
Yeah. Actually, a diabetes nurse told me about that 5 years ago, and it has really helped.
Huh. So now we need bee sting lotion or ointment, alpha lipoic acid, B6, B12, and folic acid, according to everyone. Whew. That's a lot. We need to have a little bee. We need to have a little kit in the shape of a bee with all those things.
We got to figure out why these drugs and everything cause it and cure the cause.
Because it's poison.
True. Yeah. Because it's not just
It's
Velcade,
actually poison.
but itself causes it in myeloma.
Yep.
That's kind of interesting. I have to try it here.
Well, I think some of these cures or helps that are not pharmacy driven are better for you because they seem to work better, and you can buy them over the counter.
They're
Let me give
cheaper.
how about a disclaimer? So if someone is allergic to a bee, has a highly allergic reaction to a bee sting, they probably shouldn't use it. That would be on the packaging, I would think.
It should be on the packaging. Yeah,
Box,
I have
yeah.
no idea.
Maybe it works better. Yeah, I would think that it would be for those who are watching over YouTube. Please consult with your doctor first, and look at the packaging.
Right.
Or use a very,
not-
very, very small test patch. Just a
Yeah.
little tiny bit test.
That's probably a good idea, especially if you're sensitive.
Just use a little bit.
Just a
test
test patch, you know, like you would anything else.
I have to add this to my list of helpful hints. I just have to find it. Well, this has been wonderful. I can't believe it's August. Nancy, you and I have to text. We had some good texts going on about you coming, but now you're here. We still have to continue that. Before our next meeting, I will let Judy, I have your cell phone, right?
I don't know that you do.
Do you want to put it in the chat, or I can put mine in the chat so you can text it when we finish?
Just a second. Let me get it.
Michelle, why are you coming to Texas?
I am speaking at a conference.
Okay.
And it is for, the conference is for polycythemia vera patients.
Oh, okay.
So
In Irving.
you're all welcome to come, but you know, you know enough about your own stuff, right? And about all of our stuff. I don't know if you'd
When
want
are you going to be there?
say that again.
When will you be there?
I would rather not say here, and I'll put it in the chat. How's that?
Yep, that's fine.
Actually, I'm pretty sure it's the date I'm putting in. Thank you, Judy. I see.
We're leaving the first part of September to drive to Idaho.
Oh,
We're going to go through Moab, Salt Lake City, and then just look up in southern Idaho for a new area to live. And it will depend on how far it is from the cancer center as to where we move to.
That drive will be beautiful, I bet, going through the Moab desert. I hope you're there because I arrived, well, it depends how long you're gone for. So I'm coming on the, I'll probably be coming the 12th.
So you didn't want to say that out loud, but you put it on the general.
I know. I just said it out loud. So I was like, who cares? You know, it's not like it's just, yeah, I know.
I think we're going to miss you, damn it. I mean, darn it.
Say that word. That one's okay. That's a shame.
You're going to get the social police on you from a YouTube video.
Please?
One of a million.
Excitement.
I think that word's fine. I think a lot of words are fine on social media.
I'm just talking about that water thing, you know, the dam.
Frankly, Scarlett, I don't give a darn.
Yeah. He wanted to fly because it's quicker, and I said, no, I don't fly, and I'm not going in the air.
Oh.
I'm not a flyer. I don't like it. I can fall out of a car a lot closer than I can fall out of a plane. I don't like to fly. Scares the hoochies out of me. I'm excited about the drive.
This is a very, very good meeting, I think.
You've run it very well.
We learned a lot, and we shared a lot, and had lots of great news. And, you know, I think we've done good tonight.
And I appreciate you ladies letting me be a part of this.
Well, Jim gave up, we see.
I mean, yeah, we had Jim. Jerry didn't come tonight, but you know, I better not say his name. Last time I did, you know, he showed up right in that second, and we're ending. So I hope we see him next month.
But we need you here, Lynn.
Yes, we do.
Okay. Can we stop the recording? I wanted to ask a question.
Sure, of course.
I just don't think you need to talk so much next time, though, Lynn.